name is Tanya Flaherty, and I'm going to teach you about secondary adrenal insufficiency. There are two glands located at the top of each kidney. The inside of the adrenal gland is what produces adrenaline. The outside is what produces the hormone cortisol and aldosterone. Cortisol is what helps the body reduce inflammation, absorb nutrients, and helps control blood sugar levels, and control the amount of fluids in your body. Aldosterone regulates your blood pressure and electrolytes. Cortisol production is regulated by another hormone, androcorticotropic hormone, or ACTH. This is made by the pituitary gland. That gland is located at the base of the brain. There are three different types of adrenal insufficiency. Primary, which is also called Addison's disease. The causes of that are some form of trauma that resulted in severe deficiency of both cortisol and aldosterone. Secondary, that's caused from a lack of stimulation to the adrenal cortex, which is the gland at the base of the neck, or partial or total loss of cortisol but still have aldosterone. Tertiary, which results in a decreased production of ACTH by the pituitary gland. The most common causes of secondary adrenal insufficiency are the use of glucocorticoid medications to treat other illnesses such as Crohn's disease, colitis, and asthma. Glucocorticoids are steroid hormones that act like cortisol. These medications affect the ACTH because the pituitary gland is already producing this hormone. When it's already producing this, and then you continually add more, your body gets so used to having this medication that it thinks it doesn't need to do it on its own. If a doctor realizes it quick enough, your adrenal gland can come back and function on its own. If the symptoms are not picked up fast enough, then your adrenal glands go dormant, and this causes adrenal insufficiency. Some symptoms of adrenal insufficiency are severe fatigue, loss of appetite, weight loss, muscle weakness, irritability and depression, nausea, vomiting, diarrhea, low blood pressure, and it drops further when you stand up, causing dizziness or fainting, joint pain, craving salty foods, hypoglycemia or low blood pressure, and glucose. Adrenal insufficiency is diagnosed not by routine blood work normally, because your blood levels can come back normal. Usually patients, by the time they get to the doctor, everything comes back normal, so they usually have to take cortisol levels, and that will show that they're adrenal insufficient. Cortisol is a stress hormone, also known as the fight or flight hormone. Its function is to help a person respond effectively to stress, and cortisol helps the body compensate for both physical and emotional stress. When faced with stress, the body will produce up to 10 times the baseline levels in order to compensate. When a person cannot produce the correct amount of cortisol to compensate, that's adrenal insufficiency. Adrenal crisis is when it gets to the point that a body can no longer handle normal stress and will go into shock unless introduced to extremely high levels of cortisol, usually administered through an emergency shot or steroid. There are different types of stress for everyone with adrenal insufficiency. It can be anything from going to a family function, to fighting an infection or illness, to the death of a family member, or getting into a really bad car accident. These all require more cortisol. Every patient with adrenal insufficiency, no matter which kind they have, should wear an ID bracelet or necklace stating that they have this disorder. This will make sure they receive the proper treatment in an emergency situation. In the state of Florida, there's also what we have a yellow dot program. This is for emergency responders and for anyone who has an illness. Hillsborough County's yellow dot program helps when you are unable to speak or if you are seriously injured following a traffic accident. The yellow dot sticker you display on your rear driver's side window. It alerts first responders to important healthcare information, and you locate it in your glove compartment. The information helps in decisions made about your treatment and can potentially save your life. The information is confidential, and it will help to tell who you are if you have a pre-existing medical condition that may prevent you from communicating. It will help make sure you have the correct medications. You can pick up the yellow dot medical form at any Hillsborough County fire station. If you're not in Hillsborough County, you can look up the yellow dot program in your county or state. They have it in all cities now. Thank you. I hope you learned a lot about secondary adrenal insufficiency. I'll show you. I have everybody here. My audience. Thank you.